Mental health challenges for children have reached a national emergency. That's the declaration from several medical organizations representing 77,000 physicians and more than 200 children's hospitals. Between March and October of 2020, mental health emergency room visits for children ages 5 through 11 rose 24%. And for children 12 through 17, there was a 31% increase. Joining us to talk about this is Mashana Smith, a clinical psychologist with Lurie Children's Hospital Center for Childhood Resilience. Thank you so much for joining us, Mashana. So has Lurie also experienced an increase in the amount of children in need of mental health care?
I'm sorry, can you repeat that?
Sure. Has Lurie also experienced an increase in the amount of children who are in need of mental health care?
We absolutely have. We've seen a significant increase since 2019. Our 2020 numbers, we look at them and we've seen that we have actually seen an 8-fold increase in the number of families and parents who are reaching out for services on a weekly basis. And so we've seen our numbers increase significantly. Not only have the number of intakes increased significantly, but our waiting list is about 3 times larger than it was in 2019. So by all means, our data shows that we've seen a significant increase, and we can see the impact that the crisis has had and that the pandemic has had on children's mental health.
What would you, 8-fold, that is significant in just the number of people who are reaching out. What are some of the challenges that these families say they're experiencing?
Many of the families are reporting that their children are struggling with feelings of depression, feelings of anxiety. If you think about all the children have been through with regard to out of school time, physical isolation, being separated from friends, and sometimes and oftentimes family as well. And then just being, away from their activities. So there's a significant amount of loss. Grief is certainly front and center in terms of some of the experiences that the kids have experienced. The data also shows our data, as well as the national data the CDC has, is that we've seen a significant increase in suicidal ideation attempts and completions, particularly among adolescents and even more so among girls.
Okay. We know that, obviously the pandemic plays a great role in all of this, and we'll get into that. But, among the factors is the pandemic. We know that Black and Latino families have certainly been disproportionately affected by this pandemic. How has mental health affected those two groups in particular?
Yes, happy to speak today. As you said, there have been disproportionate impacts related to the pandemic. And so we've seen an increase in terms of infection rates and death among Black and brown populations that has affected mental health. We've also seen the stressors, a disproportionate impact in terms of the economic stressors that Black and brown families are experiencing, and that too has had an impact on children of color. The only thing that I'd mention is, although we focus on the pandemic, certainly many of us have referred to what we call the twin pandemics. And so there is the experience of COVID that we're all in the midst of, but then there's also been this racial reckoning within our country that Black and brown kids have been front and center, particularly adolescents. And so I think coupling those two, we've seen a significant impact on students and their mental health, the experience of stressors that children are experiencing, the experience of loss that children are experiencing, and racial injustice, right? So all of that has had a impact on the mental health of kids.
Right, and the American Academy of Pediatrics, along with several other organizations that are issuing this declaration, they do point to the ongoing struggle and saying that the struggle for racial justice is tied to this increase, this worsening mental health crisis for children. But how have all of the events of the last year and a half compounded or exacerbated trends that we already saw happening before 2020?
Good point. So how it's exacerbated is a couple of ways, right? We already were in a crisis, if you will, with regard to children's mental health. I think it's been exacerbated by the sheer numbers and the way the losses that have been experienced. Many of the losses that we're talking about, particularly if they're COVID related, were really sudden. And so what happens is that there may be traumatic grief. When children experience traumatic grief, it really interferes with the normal bereavement process and grieving process, and it's complicated by the layer of trauma. This layered on if it was a sudden loss, if the loss had significant implications for living arrangements and caretakers, et cetera. And so that's one way in which it's exacerbated. The other way is that a significant number of children have been exposed to trauma, particularly vicarious trauma. So even if they didn't experience the trauma themselves directly, with the racial reckoning, viewing all of the trauma that's experienced, people being killed, particularly Black men being killed, but then also, the experience, with police and different injustices, and also have to think about the systemic racism and the systemic structures that are impacting mental health. So we know there's a strong relationship, for example, between poverty and mental health. Given all of the economic stressors that are impacting Black and brown families significantly more, there are higher rates of poverty, which impact mental health. And adolescents will speak very candidly about this and the way in which financial stressors impact their well-being.
Yeah, a big load for some young and some small people. Mashana Smith, thank you so much for joining us.
No problem. Thanks for having me.